Fallopian tubes connect the ovaries to the womb. When a woman ovulates each month, her egg moves down the fallopian tube toward the womb. Sometimes, fallopian tubes can become blocked. This makes it more difficult for sperm to reach the egg, and for a fertilized egg to reach the womb. Causes of fallopian tube blockage. Fallopian tube blockage can be a result of inflammation or scarring due to internal or external injury, infection, or other medical conditions. Some common causes of fallopian tube blockage include pelvic inflammatory disease, chlamydia, endometriosis, uterine fibroids, surgery. Treatment of fallopian tube blockage. Take vitamin C supplements to support your immune system. Vitamin C is required for the absorption of iron. In addition, it boosts immunity and fights infections. If your fallopian tube blockages are due to infections or inflammation, it's possible vitamin C may help clear them. Rely on herbs to combat infections. Certain herbs may help to kill bacteria or yeast that can cause infections or prevent fertility. Prominent amongst these herbs are dong quai, chamomile, garlic, oleander, turmeric, red peony root, frankincense, and calendula. Apply castor oil to increase circulation around your fallopian tubes. Some natural medicine practitioners believe the application of castor oil may help with blocked fallopian tubes by increasing blood and lymphatic circulation around the fallopian tubes. The increased blood supply may help with better functioning and removal of blocks from your tubes. You could apply castor oil directly on your lower abdomen, or you may even use castor oil-soaked packs and tissues that are easily available online and in herbal store. Try doing this daily for at least 1-2 months. Consider homeopathy for further treatment. This holistic science treats medical issues with minimum or no side effects. Many remedies in the homeopathic pharmacopoeia may be helpful in the treatment of blocked tubes and infertility. Some of the remedies you may use are as follows. Pulsatilla. It is indicated for fallopian blockages with menstrual irregularities and mood swings. Pulsatilla could help regulate your menstrual cycle and remove fallopian blockages. Sepia. It is a homeopathic remedy indicated for menstrual irregularities, painful menses, pain with a bearing down feeling, and repeated miscarriages due to fallopian blockages. Thyroidinum. If you have thyroid disorders along with fallopian blocks, or lethargy with sluggishness and tendency to gain weight, thyroidinum could help you considerably. Natrum muriaticum. It helps women who have recurrent headaches, especially after exposure to sunlight, and a craving for salty and sour food items. Fallopian tube blocks with delayed menses, bloating of the abdomen with gas, and headaches are an indication for Natrum muriaticum.